Morning, everybody. Thank you for joining us. Stephanie Erickson here, family caregiving expert, social worker, trapeze junkie, as I like to say as well, flying high through the air. Very excited to have with me today Dr. Nikolai Whyte. We're going to just refer to him as Nick throughout the interview, but he is a physician. He's an MD. He works out of Toronto. And today we're going to be talking about non-traditional versus traditional medicine. I know for myself, I do a lot of non-traditional things. I love Reiki. I love meditation. I like neuro-linguistic programming. I'd love to try sound healing. I mean, there's all sorts of things that we can do to help heal our bodies that don't involve medications, that don't involve surgeries, and those sorts of things. But those things are also essential. And we certainly don't want to ignore that we also have to see our physicians and get our regular checkups and exams as well. So we're going to talk about this with Nick today. Nick, welcome.
Thank you, Stephanie. It's good to be here. Thanks for having me.
It's my pleasure. So I'm going to put my glasses back on and just give a little bit of a bio about you. So as I said, we've got Nikolai Whyte here. He works out of Toronto. He did his medical school in the University of Toronto, but funny enough, prior to that, he had a boot camp business. So if you follow him on Instagram, which is, I think, at dr.fitnick, is that right?
That's right, yeah.
Okay. You'll see that he is definitely in shape and he's definitely doing stuff to take care of his body. Ladies, you should follow him on Instagram. But not only does he take care of his body, he's also taking care of his mind and his soul, and we'll talk about that today. In terms of his experience, he worked on a native reserve, and he also did a fellowship with obesity medicine. Right now, he's a jack of all trades. He's doing all sorts of stuff. He works in a family medicine and urgent care clinic. He does some online telehealth, which he and I were just chatting about. He works at a wellness and medically supervised weight loss or weight management, I guess you call it, clinic. And he also does cosmetic injections. Maybe you and I should have a talk offline about what you can do to help me out.
Yeah.
Is there anything that I missed there, Nick?
No, that's pretty accurate. Thank you for that introduction. Appreciate it.
Okay, so I know that you have a background in fitness, and we're going to talk about the importance of proactive care. I know that, you grew up in a world where your mom was really about taking care of herself and vitamins and health and probably healthy eating as well. I want to get to those kind of proactive lifestyle things later, so we will get to it. But just right now, in terms of traditional versus non-traditional, I need some, I guess, definitions. So when we say non-traditional, in my mind, there's terms like holistic that comes in, naturopathy that comes in, Eastern medicine. Can you clarify what all of these things are for me?
Right. So traditional medicine is one term that's used to describe the, I guess, the establishment of medicine in North America, but also in Europe as well. So in some ways, it's Western medicine. These are medical doctors and surgeons, so physicians and surgeons who have completed an accredited degree in what's called a doctor of medicine or a doctor of osteopathy as well. And so that would be your typical doctor who you would go to see for most problems, or your surgeon who you might go see for most problems. This is the type of practitioner that most people are familiar with when they're referring to a doctor. So I would define kind of that space as traditional medicine for the purposes of this conversation. Naturopathic medicine is a separate field. It's a related field, but it focuses on a sort of a different approach. There's different philosophies and different schools of thought in the naturopathic world. There is some overlap between naturopathic medicine and traditional medicine, but the approaches are slightly different. Naturopaths tend to take a I don't want to use the word natural, but I guess non-pharmaceutical approach for most problems. There are some other ways that they treat and manage health concerns that are sort of not used in traditional medicine. Eastern medicine, I believe, refers to schools of thought from the eastern part of the world, so specifically from Asia, Chinese traditional medicine, there's Indian traditional medicine, there's African medicine, anything that is sort of separate from the realm of what we would call Western medicine could be classified as Eastern medicine. So those are, and then there's other types of non-traditional medical practices, including holistic medicine, which again is a slightly different approach. There is different definitions out there, but I think for the purposes of this conversation, we will, traditional medicine, we're referring to your traditional doctor who you might go see for most of your medical problems.
Yeah, and I guess there's been a real move towards moving back towards these naturopathic, holistic Eastern medicine ways. I mean, I think that's how probably the world began, right? Before there was traditional medicine and people were using all sorts of interventions. Then we really moved away to, no, we need a blood test, we need a cause, we're going to treat it pharmaceutically or with surgery. And then now I think people are starting to feel like, we're going to move back into this other area. As a physician, I know that you support these other types of interventions, but are there some ways, Nick, like if someone comes to you and says, these are my symptoms, do you discern immediately, okay, we need to go this route and we need to start medically with these medical interventions, or do you immediately kind of push them to non-medical, or do you right away sort of combine the both?
Well, again, it depends on the nature of the problem and it depends on the individual patient. I would say as a traditional doctor, a medical doctor, I have access to certain investigations that other doctors in Canada do not have access to, simply because of limitations of the scope of their licensure. So for example, I'm able to order blood tests. I'm able to order imaging, x-rays, ultrasound, CT scans, etc. So often that helps me in terms of my diagnostic process, and it gives me the ability to go a little bit more in depth than, say, a naturopath might be able to do. Currently, in Ontario at least, naturopathic doctors are not able to order blood work on their own, and therefore they may be limited in terms of what types of diagnoses they may or may not be able to make. Often, in my experience, I do get patients who have seen a naturopathic doctor who come to me with a request for certain blood work that they'd like to have. So I do think, in the naturopathic space, they are interested in things like serology and having blood work.
What's serology? I'm sorry, I'm clueless. Serology.
Let me clarify. Serology just means blood work.
Oh,
so blood work.
Very fancy term.
Sorry, I'm using jargon. Blood work is important, I think, for all of us. It's evidence, it's factual data, and I think we all like to use it, but only certain doctors can order certain types of tests. Right. So to answer your question, it really depends on the nature of the problem, and it depends on the specific patient. In a younger patient, I may be more inclined to do a more, let's call it, conservative approach, where I might first start with a physical exam, with a thorough history of the problem, as well as maybe starting with just some tips on diet, on exercise, and general lifestyle things. Whereas if it's an older patient who's in their 60s or 70s, we may move more towards medical interventions sooner, because there may be higher risk of pathology present.
And the thing that I think people don't think about, I've said this to my mom, and maybe you'll correct me, maybe I'm wrong, but sometimes she'll say, oh, I went to the pharmacy and I picked up these pills or these vitamins or these such and such that I just found over the counter that's going to help me with whatever it is, and I'm going to start taking them. And I'll say, whoa, wait. Have you talked to the pharmacist about interactions? Have you talked to your doctor? I think that's maybe one of the misconceptions about going a natural route. And I'm not saying you shouldn't go a natural route, but you have to be speaking with somebody about the combination of these two practices. Is that right?
So it's important to be aware that there are some side effects that can occur from natural remedies, such as vitamins, such as other health supplements. And therefore, it is important to discuss this with your doctor, especially if you're someone who has other medical problems and is on other medications. It is important to bring that to the attention of your prescriber, because they can cause complications that we want to make sure are not happening. So one example would be St. John's wort. or vitamin E can both increase your risk of bleeding because they are blood thinners. So you shouldn't just assume that because something is natural that it can't have a negative impact on your body. Another example would be vitamin A. Vitamin A can cause toxicity if it's taken in high doses. Same thing with vitamin D. While it is safe and highly recommended, if taken in very high amounts, you can actually overdose on vitamins. And so that can be a true medical problem. And so don't just assume that because something is available over the counter or at your local supplement store that it's completely safe to take. Okay, it is important to discuss that with your primary care provider.
And do you think that for most people, they could benefit from the integration of both traditional and non-traditional, or do you think it's really just for like a specific group of people?
Absolutely. The direction that healthcare seems to be moving towards is a team-based approach where you have sort of your patient, and then there's a team of healthcare professionals who are all working together to help manage each person on an individual basis. So, in a perfect world, there would be communication between the medical doctor, the naturopath, the dietitian, the personal trainer, the psychologist. Everyone would be able to communicate and understand exactly what's going on. Unfortunately, that's not the way the system works right now, and often there is no communication between these individual providers, and so it's up to the patient to sort of relay information from one provider to the next. And that's where problems tend to happen. That's where there's communication breakdowns, and I think that is one of the reasons why there is some clash between traditional and non-traditional practitioners. But I do think most people could benefit from having access to both. And there are certain problems that, that I am unable to provide any additional help with, whereas a naturopath might come in and be able to offer some insights. So I think it just depends on the nature of the concern that the person has.
I really hope our healthcare system does move in that way, because I agree with you. I mean, there are so many things that we could be, so many ways in which we can help people if we were all communicating. I find that all the time, that the right arm's not talking to the left, and that the patient, although doing their absolute best, is not necessarily the best self-reporter, not only of their own symptoms, but also of what people are saying to them. So I think it would be great if there could be that integration, and you're hoping to, that it moves in that direction. So let's talk a bit about preventative type things we can do. So that would, in my mind, it seems like it's kind of on the more holistic direction in terms of preventative, because we're not having to intervene once a problem has been diagnosed. We're pre-medication, we're pre-problems. And I know something that I read that you wrote, I don't know where I read it, you were saying that, things like, diabetes and high blood pressure, so many of these things we could be managing and preventing at the front end. So how do you do that with your patients? Because now we're talking lifestyle changes, and like, if you told me, no, don't drink 2 glasses of wine on Saturday, really, you should only drink 1. I might, you're changing my lifestyle, and I may not want to do it. How do you work with people to get them motivated to do that?
So in my experience, the prevention is absolutely critical for our entire healthcare system. Most of the problems we have in Canada are preventable diseases, in the United States as well. And I think early intervention and early, speaking to people who are healthy is important, and young as well. And so in my practice, I would say, different clinical settings where I practice. In one setting, I tend to see patients who already have a diagnosis, and we'll use diabetes as an example. Often people are diagnosed with diabetes when they're in their 40s, sometimes in their 50s. At that stage, it's very challenging to make long-term lifestyle modification, because people have already established habits. They've already established their entire routine. Although I can educate them on lifestyle, such as telling them what diet to follow, telling them how to exercise, etc. Some people can do that, and they're very good at that, but I find that the majority of people may be able to do that for a few weeks, maybe a few months, but often revert back to those lifestyle habits that they've already established. So my personal belief is that we should start talking to young people, people who are in their 20s, people who are in their 30s, in their 40s, and start intervening prior to them developing diseases such as diabetes. So right now, in my wellness clinic, where I do what I would call wellness medicine. So these are people who are either very healthy or may have some weight to lose, or may have early high blood pressure or early signs of prediabetes. I do an intensive lifestyle modification intervention. We talk about diet. We look at their diet program. We try to make specific changes that are going to be long-term. It's a longitudinal program, so I follow them over time. It's not just an episode of intervention and then I never see them again. I have frequent follow-ups with these patients or clients. We're using self-monitoring and objective measurements to monitor these things, such as blood work every year, such as doing body composition analysis. So looking at their body fat percentage, looking how much muscle mass they have. We measure things like their fitness levels. So we're motivating people to continue to modify and develop their lifestyle in the right direction. And these are the people who actually never end up developing these diseases because they learn these lifestyle habits early on. And we know in the medical community that exercise is by far the most important intervention that there is. It works for everything. It works for diabetes. It works for high blood pressure. It works for dementia. It works for cancer. It works for preventing all of those things. I mean, it's not going to treat cancer. It's not going to cure cancer, but people who exercise tend to not get cancer as much as people who do not exercise. And so personally, I believe that the medical community should focus more on prevention. I think that would save us a lot of healthcare dollars. I think it would make the population much healthier as a whole. And I'm a big advocate of us intervening early on and using our authority as medical professionals to educate patients on how to develop a better lifestyle that's sustainable and that's going to prevent them from developing some of these chronic diseases.
I love hearing what you're doing. And I think that a lot of this is systemic, like what you're saying. And what's so surprising to me is that you did break it down in dollars and cents. If we changed our, let's say, reimbursement program so that, let's say, physicians could, have the same reimbursement rates for doing wellness management and wellness visits and things like that as they could if they were, writing a prescription for diabetes, things could change. And people, if they were getting these kinds of care and services and they didn't have to pay out of pocket, I think that would motivate people a bit more. But there's also that mind shift because we're a, well, let me just take a pill society where it's not a problem until it is a problem kind of society. A friend of mine was telling me about someone that she knows. My friend is a dietitian, and she's speaking today actually on the keto diet, which she thinks is so unhealthy because you can't eat bacon your whole life and somehow not have problems down the road, But she was telling me that someone she knows is very obese and can't get pregnant. And the physician said, you need to lose weight and it's going to help you get pregnant. Go on the keto diet. And she said, well, should I meet with a dietitian? He's like, no, just look it up online and follow that diet. And my friend is like, this is terrible. This is not sustainable. This is not good for her health. How is she going to learn habits that will keep her healthy for the rest of her life? And I think that's so much of where we are as patients and a society, and also, unfortunately, in the medical profession, some, not all, but some are there too.
Yeah, absolutely. After I completed my residency in family medicine, I did an additional fellowship with the American Board of Obesity Medicine, which obesity medicine is a large and up-and-coming field of medicine. And essentially, look, what we know is that it is not about what diet you follow. It is about the behaviors that you do on a day-to-day basis. Do you follow any diet, right? Or do you just do whatever you want? Pretty much any diet will work. It's about having a structure. It's about having a context towards your life and towards your eating and towards your habits. And so developing a routine where you are thinking about what you're putting into your body, where you're thinking about your exercise, where you're thinking about following some structure is the key. It's not necessarily about a magic diet that's going to fix all of your problems. We want something that's sustainable, that can be maintained over the long term, over the next 50 to 60 years until, you know, and that's, I think, the most important thing. And so unfortunately, most physicians, whether they be traditional or non-traditional doctors, are not educated on the actual evidence around diet and how that works. It's a fairly complicated piece, and actually we're only learning now sort of how the implications of certain diets and how they work, and what actually results in long-term health and wellness.
Yeah, and it's not even just the physical stuff, it's even mental health, right? So, I mean, I myself have lived with anxiety my entire life, and there was a period of time where it was really acute, panic attacks, not leaving the house, and I had to take medication because I wasn't functioning and I was really falling apart. But I haven't taken medication in 15 years. I meditate daily, 15 minutes a day. Like, I've integrated all of these other practices into my life, and it's not that I'm anti-medication, I'm not. But I don't want that to be the sustainable coping mechanism for myself. I want to find those other ways: regular exercise, watching my diet, yes, drinking a glass of wine on Saturday night. No, I'm tongue in cheek, but you know, like you have to find other ways to cope as well. I don't want to take up too much of your time, Nick. So if you could just maybe give some last thoughts to the viewers about, okay, maybe if there are particular symptoms where you say, if you're having these symptoms, go see your family physician first, or maybe any symptom you would say that, if you can give some tips on that, like to direct somebody that way, and then give some tips on if somebody wants to integrate some natural ways, natural interventions, acupuncture, Reiki, meditation, yoga, some advice that you give to those people as well.
All right. So, you know, my philosophy in general is that for any type of healthcare problem, I think we should always start in a step-by-step based approach, starting with the most conservative approach and working to more intensive or invasive approaches as needed. So if you have a problem with your weight, or a problem with your blood pressure, or a problem with your cholesterol, the first step is always going to be diet, exercise, and just general lifestyle modification. I always give people a chance to work on those things for at least 6 months before we even discuss the possibility of starting any type of medication or any type of medical intervention. And in some cases, the medication is not a lifelong thing. It's just a temporary bridge to get you from point A to point B, which in that bridge period of time, you're working on the habits, the routines that are going to be important for your long-term health. And the hope is that we would be able to either discontinue the medication or continue at a very small dose and be able to sort of minimize the medical intervention that we're doing. In regards to symptoms or concerns that you might have that would be reasons to visit your doctor, look, if you're having any symptom of anything whatsoever, headaches, abdominal pain, shortness of breath, chest pain, any of those things should be reasons to go into your doctor. I think many people wait too long and don't go in, and by the time you're having symptoms is often when things are a bit more advanced than we'd like them to be. So don't hesitate to go in. Make sure you are getting your annual checkups. Even if you feel great, you feel well, it is important to just know that everything is okay and to have a good relationship with your primary care provider. So, you know, the short answer is, if there's any concern, go in. That's why we have a universal healthcare system here in Canada, and we're lucky enough to have access to providers. So you should use that. You're paying for this through your tax dollars. It's not a free system.
And if someone wants to go see a naturopath or try some of these other non-traditional interventions, what's some advice that you can give, or some tips, maybe things to look out for or things to look for when you're choosing somebody?
I think the most important thing is having a practitioner you can have a good relationship with. So whether it be a naturopath or a traditional doctor, make sure it's someone who you like, someone who listens, someone who understands your concerns. There's good naturopaths and there's people who are not so good. And the same thing applies for traditional doctors. And I think the most important thing is choosing someone who you have a good relationship with. You know, naturopathic doctors can help with many interventions, I would say most of them are wellness based, so things that are relatively minor in concern. If you have a more serious concern, something that's a true medical problem, at that stage it is important to have the opinion at least of a traditional doctor as well. So don't forego proven theories in favor of more non-traditional theories, because it is important, I think, to get the opinion and to be educated on all aspects. And then it's up to the person to make a decision on what's best for them. And some people prefer to have a naturopath as their primary care provider, and that's fine, but you should at least be educated on all of the options that are available to you.
Yeah, and I guess just if a tip that I would give, and correct me if I'm wrong, is if you're seeking those non-traditional ways and that provider doesn't want you to talk to your physician or doesn't want to have that collaborative relationship, that would be a red flag. And the opposite direction as well is that feel free to tell your physician, I'm also pursuing this other type of intervention. Will you be willing to discuss your whatever treatment plan, your recommendations? Those are the kind of providers that you want, that are willing to listen to the other and work collaboratively.
Absolutely. The model that we strongly adhere to in family medicine is a patient-centered care role. And that means that the patient is the person who makes the decisions. It's not the doctor. And our job as the doctor is to explain to the patient the risks, the benefits, and the alternatives to any intervention that we do. So it is important to integrate all of the options available and make sure that the patient understands them and can make an informed decision. And at the end of the day, it's their decision, it's their body, and you just want to support them in whatever it is they choose.
Okay, well, thank you, Nick, very much. And maybe we can do this again sometime and talk about another subject. Yes?
Absolutely. Thank you, Stephanie, for having me. I'd be happy to come back anytime.
Good. Thanks.
Have a good day. Bye.